Hi, welcome to Dental Terminology. I'm Becky Gerber. Following are just a few of the basic terms that you will hear in a dental practice. Let's get started with the jaws. The term dentition means the natural teeth in the jaw. The term edentulous means all missing teeth in the jaw. Primary dentition is otherwise known as the baby teeth or deciduous teeth. Most children have 20 baby teeth, 10 on the upper arch and 10 on the lower arch. Permanent dentition refers to the adult teeth, and the adult teeth are designed to last a lifetime. Most adults have 32 teeth. 16 on the upper arch, 16 on the lower arch. The arches are referred to as the maxillary arch for the upper arch and the mandibular arch for the lower arch. The arches or the mouth are divided into quarters, otherwise known as quadrants. The human body is divided into half by an imaginary line down the middle called the midline, and each side is mirror image. This is the chart view of a patient record. Please notice that the patient's right is your left and the patient's left is your right, just like shaking hands. The permanent teeth are identified by numbers 1 through 32. We start on the upper right and counting 1, 2, 3, all the way to the upper left, and the back tooth is tooth number 16. Then we drop down to the lower left, and the back tooth is number 17. The next tooth is 18, and we wrap around all the way to tooth number 32 on the lower right. There are two types of teeth. The first type is the anterior teeth, which are the 6 front teeth in your smile line, and they are used for tearing food. The next type are the posterior teeth. They are the teeth in the back. They are used for grinding and chewing your food. These are the clinical names of the teeth, and again, upper and lower and mirror image. The front 6 teeth on the upper and the lower are referred to as the anteriors. The next teeth over, 2 in each quadrant, are referred to as the bicuspids. The next teeth over, 3 in each quadrant, are the back teeth or the molars. This is the anatomy of the tooth. This outside layer of the tooth is the enamel, which is the hardest substance in the body. The next layer is referred to as the dentin, which is much softer, and the layer around the tooth on the outer portion is referred to as the cementum, while this inside core is called the pulp or the nerve. Interproximal means in between the teeth, right here. This is the chart of the growth and development of permanent teeth. This person is between the ages of 21 and 25 years of age. And again, upper, lower, and mirror image. The first 2 teeth are the central incisors. The next 2 are the lateral incisors. The next 2 are the cuspids. The next are the first premolars or bicuspids, and the next are the second premolars or the bicuspids. Then we have the first molars, otherwise known as the 6-year molars, and then we have the second molars, otherwise known as the 12-year molars, and we have the third molars, nicknamed the wisdom teeth. The primary teeth are identified by letters A through T. So we start with tooth A on the upper right, and then wrap around to tooth J on the upper left, then drop down to tooth K on the lower left, and wrap around to tooth T on the lower right. Primary teeth are important for speaking, chewing, and holding the space for the permanent teeth to grow and develop. This is a chart of the development of the primary teeth, and this is a child age 2 to 5 years of age. Right here we see that the tooth buds of the primary teeth are already developing in this jaw. And again, it's upper, lower, and mirror image. The first two teeth are the central incisors. The next two teeth are the lateral incisors. The next are the cuspids or the canine teeth. The next are the first molars. And then the next are the second molars. Surfaces are used to describe or identify the size and the side of the decay or the restoration on a tooth. A tooth has 5 surfaces, and they are identified by abbreviations. So the abbreviations are as follows. The D is for distal, and that is the interproximal tooth surface that is furthest away from the midline of the body. The M stands for mesial, which is the interproximal tooth surface that is towards the midline, or the wall that is in between the teeth towards the front of the mouth. The B stands for buccal, which is the tooth surface that is closest to the cheek or the lips on the back teeth, the posterior teeth. And the O is the occlusal, or the chewing surface of the tooth of a posterior tooth, a back tooth. And here is a picture of the surfaces. Here is the midline, and this whole section right here is the buccal, which is nearest the cheek on the posterior teeth. The distal is the back wall of the tooth. The mesial is the front wall of the tooth, and the occlusal is the biting surface of the tooth. We have 3 more surfaces. The F for facial is the tooth surface that is nearest the cheek or the lips on the anterior teeth. So that would be this part right here, this whole section. The incisal is the cutting edge of the anterior teeth right here. And the lingual is the inside surface of the tooth closest to the tongue. We have a couple more dental terms to talk about. The first, the clinical crown is the top third of the tooth that is above the gum line. The 2/3 of the tooth below the gum line or embedded in the bone are known as the root. The gingival tissue is the soft tissue that is surrounding the teeth, otherwise known as the gums. Impacted means any tooth which never came through or never grew into proper position. Mixed dentition is the combination of both primary and permanent teeth and is in most adolescents. Caries is another word for decay or cavities. Congenitally missing means teeth that never formed, and supernumerary is an extra tooth, and usually it is an incisor or a molar. Keep in mind, these are just a few of the words that you will hear in a dental practice. Once you get positioned in a dental practice, please make sure to ask the staff for any other terms or procedures that might be used. And also, please be sure to check out Dental Terminology by Charlene Dofka, and then check out our other references in our resource section of our online curriculum.